Could we get a roll call, please?
Helen Walker. Elizabeth Taylor.
Present.
Richard Richardson.
Present.
Kathy Bowles. Gary Hayjack. Russ Perkins. Lisa Gulliver.
Present.
Sandra Murphy.
Present.
Casey Clark.
There's 6 members present, so I assume that qualifies us for having a quorum. Next issue on the agenda is old business in terms of review and approval of the December 4th, 2025 Senior Task Force meeting minutes.
Move approval.
I second.
All in favor?
Aye.
Opposed? Abstentions? Minutes are passed. Moving on to our new business, one of the things which I asked for was that to be placed on the agenda is the review of our task force purpose from a couple of different perspectives. One, that it is our grounding structure that moves us forwards in our task. Also, that it provides us a memory in terms of when we, and I'm guilty of this myself, going off in conversations where we may go off in a tangent and that we may be need to refocus and come back to that perspective, and also to look at the charge, the overall charge in which the Genesee County Board of Commissioners has placed upon this task force. And in review of that, the Genesee County Senior Task Force needs to assess the needs of older adults 60 years plus in Genesee County and to make non-binding recommendations to the Genesee County Board of Commissioners as to problematic service budgetary priorities for this special and important populations. Our recommendations are supposed to be put in writing and delivered to the Board of Commissioners no later than June 1st, 2026. And our recommendations are supposed to be based both on qualitative and quantitative findings. So please remember that as we move forward in the meeting today. When we put the agenda together, one of the things which we identified was that in terms of structure, is there a mechanism for public input in terms of information which the public would wish to share with the task force? Based upon looking at it on that issue, we have created an email system for the public to send in comments and concerns in terms of the task force and our mission. I'm going to have Brad go ahead and talk about the structure.
Thank you, Mr. Chair. So yeah, in order to put some kind of structure to it, what we set up is an email address, which is actually located on the website that all of our agendas and all the public has access to, which is seniortaskforce@GeneseeCountyMI.gov. So those communications come in. They actually go to Gwen and myself. There'll be a notification we're working on that goes back to that person that says, yes, we got your email, be forwarded, that type of stuff. And then we will collect all the emails up for that month. And then we'll send one email with every email that we receive to this task force. So then you can kind of walk and look through all those task force emails. In addition to that, we also will provide, which we did today, you'll have printed copies of those emails as well. So in case people want to actually look at them. So if you look in your packet today, towards the back, you'll see a copy of all the emails that were received up to this point. The couple other things that, just as a reminder, as we go through this process, That senior task force email, if somebody says, hey, I have some great information I want to share with you, if you give that email out, that is the absolute best way to make sure everybody in this task force gets that information, which is easier on everybody trying to juggle. So highly, highly, highly recommend if you get a question, I have something I want to say. And that allows us to track it and also be able to make sure we share it with everybody. So it's super important that we do that. The second thing that may happen in this process, you may be contacted by the media for comments, questions, whatever. So also in one of our emails that we sent out, all those media requests or comments should be forwarded to Genesee County, our Director of Communications, Jared, and then he'll take it from there. Process. We just want to make sure as we walk through this process, we have a very clear process for committee members, so that when and if somebody does come and ask you a question, that you have an answer for them. And I think that's about it.
On behalf of the task force, I'd like to thank both Derek and Gwen for establishing this and serving as facilitators in this process. Our next agenda item is the Valley Area Agency on Aging in terms of their presentation. I'd like to call Ms. Albert up at this point in time.
Testing, testing. Can you hear me? They said put a fist. Speak back a fist. So hello, everybody. My name is Yashika Albert. I am the president and CEO of Valley Area Agency on Aging. I am blessed to say I have been at that organization 27 years now. And thank you for calling and requesting me to give a presentation to explain the multitude of services that Valley does. I don't know if you want to. Do you want to stop and do questions as we do the presentation? Do you want to hold them until the end? Whatever is your pleasure.
Why don't we address questions as you move along through the presentation?
Our mission statement is to provide action, answers, and advocacy for the elderly and disabled adults of Genesee, Lapeer, and Shiawassee counties by enhancing lives, empowering choice, sustaining independence, and supporting caregivers and their families. Our tagline is, we are all things senior. There's 16 area agencies on aging across Michigan. A lot of people don't realize that. They're actually nationwide. But specifically in Michigan, VAAA is a federally designated entity. We were established by the Older Americans Act. So it would take an act of Congress to get rid of the area agencies on aging. In the Older Americans Act of 1965 and the State Older Michiganians Act. And our original purpose, way, way, way back in, and I'm going to take you down history, back down memory lane a little bit, was for planning and coordinating services and advocating on behalf of seniors 60 years of age or older. Again, there's 16 area agencies on aging in Michigan. And in 2026, we are happily celebrating 50 years as a private nonprofit serving Genesee, Lapeer, and Shiawassee County. Our focus is on the area agency on aging's focus, all 16 of us, is advocacy, planning, and service provision and monitoring. So the advocacy piece, even though that is pivotal to what area agencies on aging do, I just kind of hit on some of the advocacy things we did in 2025, fiscal year 2025. 2024, 2025, we advocated for seniors in many, many different ways. We attended the U.S. Aging Policy Briefing in D.C. and visited every legislator that represents Region 5 to educate them about senior priorities, senior funding, senior services. Our focus was to expand access to the program that we run called the My Choice Waiver Program and increase funding for home and community-based services and support for family and informal caregivers. Another thing we did every year, we have on the front lawn of Lansing, we have a state association. It's called the Area Agency on Aging Association of Michigan. In other words, 4AM. Every year we have a legislative gathering on the front lawn of the Lansing Capitol, and we meet with all of the legislators that represent Region 5, and then we give them information regarding services, priorities. We did a petition at our local Senior Power Day where we obtained 400 signatures on a petition requesting the legislators to increase funding for senior programs, and a copy of our petition was given to each legislator. VAAA also annually holds Senior Power Day. It's the fourth Wednesday in May. I can give you the date shortly. I hope to see you all there. We have our senior centers there. A lot of the service providers are there. Lynn is there and her team, so I hope to see you all there. It's an event that provides resources and access to legislators, to seniors and caregivers. And in fiscal year 25-26, those 2 years combined, about 2,000 seniors and caregivers attend. Last year, it was a low number for us. It was cold and rainy, so we had about 800 people come through. That's a low number for us. So the year before last, when it was beautiful, we had about 1,200. So between the 2 years, it was 2,000 seniors. And then we also wrote letters to legislators on various topics, including the direct care worker shortage, DCW wage increases, request to hold harmless senior programs during budget cuts. We asked for budget resolutions to stop what we call CRs, the continuing resolutions, and those government shutdowns, advocating for the decreasing cost of medications, advocating for protections for seniors facing elder abuse and financial exploitation, and various other topics. We've done way more advocacy than this, but I know the focus is on other areas, are some of the top things that we did in 2025. Planning. This is a big piece of what the Area Agency on Aging does. We're monitored by many state and federal organizations and local organizations because Lynn monitors as well. We're monitored by MDHHS, which is the Michigan Department of Health and Human Services. They require all AAAs to develop a comprehensive 3-year plan that will be utilized as the blueprint to carry out all of the missions of the Area Agency on Aging. This 3-year plan is called the multi-year plan. The plan must be updated annually. The updated plan is called the AIP, which means Annual Implementation Plan. All plans must be approved by MDHHS, and we have to present the plan and get it approved by all of our state commissioners.
Is the plan done by outside consultants or firms?
No, the plan is done by us. And I'm going to get into more detail about the plan too, and how we come up with the data. As part of each plan is done by each individual AAA. All of us have to submit a plan, and each AAA does their own plan.
Who is involved in the plan?
I'm going to get to that. Part of the planning requires the VAAA to get input regarding priorities and gaps in services. Input was obtained in the community several ways. We've done focus groups. We did public hearings. We review many of the various community needs assessments that are out there. We look at census data. We look at VAAA data, and we look at surveys completed by homebound participants because they can't get out in the community. They can't come to public hearings or focus groups. So we do surveys to get their input, especially since the bulk of our clients are homebound. Census data 2023, beginning the MYP. So before you is how we look at the population, and it also determines how we do our funding dissemination. And I'll get to that a little bit more in a moment. But I'll just focus on Genesee County. But the total population, and these are 2023 numbers, 2022, 2023 numbers. But they are the newest numbers off of the census website. Total population was in Genesee County was 406,770 people. The 60-plus population, actually these are 2020 numbers. The 60-plus population is 99,123. Those that report the greatest economic need, roughly 150% of poverty, is almost 17,000. Almost 21,000 are 60 years of age or older and identify as a minority, and almost 33,000 are 60 years of age and identify as being frail or disabled. Yes. 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 2025 information and assistance data. One of the services that we provide, and one of the services that is covered for Genesee County for the millage, is information assistance and intake. So some of the data that we use is we look at incoming calls that come in. So in 2025, we got 18,187 incoming phone calls asking for information. It could be just, can you give me a list of the local senior centers? Could be, hey, my mom's in the hospital. I don't know what to do. Can you give me the number to some nursing homes? But most of the time, it's wanting help with an assistance with services. And so we usually have to do an intake. Service Point is our online referral system. So in addition to the 18,000 phone calls, we get over 6,000 referrals online as well. Below that, the electronic INA referrals, we get, now this is addition to that number at the top. We get almost 1,200 referrals on our website. We get about 450 faxes. We have a referral system with My Bridges that we get almost 1,700 referrals from. A software system called Find Help. We got 184 referrals from, and then Unite Us and VA. We didn't do any referrals from, but we get information. We got a direct line with VA, so they call us directly with those referrals. They don't go through Unite Us. So that is an additional 4,138 referrals. So between those three, what is that? 22, almost 30,000 phone calls and referrals that we have, and intakes that we have to do. We also do outreach. 130, we get 136 events year to date. So far, we've had about 5,000 attendees, 836 caregiver referrals, approximately 153 caregivers of the people that called in. In the outreach events were caregivers that identified themselves as caregivers. And then caregiver outreach attendees were 738. Total caregivers reached is almost 2,000.
Is an outreach event? What does it look like?
Any outreach event like Senior Power Day is considered an outreach event. Any event that you go to and information is being disseminated. What is then, if you don't mind me asking, what is that event that the event that the senior centers throw? No, not. Yes, Senior Day at the Fair. That's considered an outreach event.
Are there any standard outreach places that you can go?
No.
These are just sporadic things.
Yes. Actually, we cut back on our outreach events. Last year, we did almost 400. And we had to bring people in to answer the phones. So, no, there's no, other than Senior Power Day, the senior event, the senior winter games, we may come there, our annual meeting. There's some events that we do attend every year because an organization has it every year, but we get invited to many, many community outreach events. It could be a church outreach event. It could be a assisted living outreach event. It could be a plethora of different organizations.
Senior centers?
Oh, yeah. Yeah. If we do a presentation, yes. Or if we disseminate information, yes. Like, for instance, at one of the senior centers is where actually, I don't even think we counted that as an outreach event, but one of the senior centers may do something specifically for caregivers. I can't remember what actually one of them did. And they asked us to come and set up a table and disseminate information. That's an outreach event. Churches do community outreach events, and they ask us to come set up a table and give out information. So we don't know each year who's going to call and ask us to set up an event.
I think we also need to keep in mind that in addition to the outreach events, you constantly have the intake and assessment call center and that approach in terms of there's individuals that need assistance, that is the mechanism that they would probably use versus an outreach event.
It's a combination of both. Like I said, Senior Power Day, during the rainy season, we had 800 people. And that's a rainy season. Rainy day, we had 800 people. That's considered an outreach event. Sir, did I answer your question?
Offer some,
But we don't always plan these. Most of these we actually don't plan. Someone in the community plans an event. They want resources given out, and then they call us and ask us to be one of the organizations to hand out resources. Most of these we don't plan. We just attend. So they're invited to these events. Correct.
I'll just wait till later.
Okay. And then we had very specific targeted locations, 23, like we wanted to do some outreach events we wanted to try to reach more people that actually needed the service. So we started doing outreach events, meeting with doctors' offices, collaborative doctors' offices, hospitals, things of that nature. So of those events, we had 895 attendees. Dialysis centers. We've done an outreach event at a dialysis center, a couple of dialysis centers, stuff like that. This is our service breakdown. The bulk of what we do in terms of the services that Valley Area Agency provides is called community. Now, I'm not talking about millage. Let me be clear right now. I'm talking about in general, is the community living and supports. That is a service that the state kind of bunches together so that instead of you ordering personal care and a little bit of respite and a little bit of homemaking, it's a bundle. So community living supports is a bundle of services. So approximately 41% of the services that we do that from our funding is community living and supports. 16% of the funding goes towards the care management service. 3% is respite. 4% is just personal care. 1% is just homemaking. And 3.5% of the funding goes towards information and assistance. Now, this isn't necessarily talking about millage. This is in general. We have a large budget. Case coordination and support is roughly 3%. Other is 8%, and then something called residential services is around 7%. Home delivered meals is about 9.5% of our budget. Congregate meals is about 3% of our budget. So as you can see, as I said, the bulk of our services go to keeping people in homes. Most of the people that we serve, not all, but most of the people that we serve are homebound. That's why, if I can come here, all of that goes to in-home people, homebound participants.
Genesee County,
Yes,
or this is Genesee, Lapeer, and Shiawassee?
this is Genesee County.
Do we have any, this is, I assume, for 2025 or 2024? Do we have anything showing that, say, the last 10 years? Each one.
I did not, but I can get it. It's going to take a little time.
I'd like to see trends.
But to be totally honest, in-home service is the bulk of what we do. I can get you a graph.
I'm thinking of other things. Generally, all the data needs to be, we need to see what's happening over time.
I would like to ask one more question. So how did you get to deciding that in-home care is the largest service that would be provided?
So we have many, many programs. Some of it is based on whatever the program that the person is in. But a nurse and a social worker go out. They do a very, very comprehensive assessment for all of our programs. And then they sit down and develop a care plan based on the findings. So what services are put into the home.
So what services, for an example, I would like to see more physical activities at the senior citizen centers. And I think silver slippers or sneakers. And the other one is about arthritis. Something like that, yeah. So how do you decide, which helps me stay at home and be independent? How do you decide which of those services are more important to Genesee County senior citizen centers?
Well, we don't. Now, for the most part, is all in-home service or pro community, and I'm going to get to that in a little bit in the further in the presentation. But for community service, we have full-time, 2, 3 full-time staff that do all of those wellness programs that you just spoke of. So whenever they want those, whenever anybody, we do them at several senior centers, some assisted living, some churches. We do them at several. We even do them at Senior Power Day so that people can get an idea of where classes are. So whenever an organization calls us and says, "Hey, we want," we also have something new addition to Silver Sneakers. We also have something called Silver and Fit. They call us and say, "Hey, we want you to do this program." We try to work it into our schedule. Some of the programs are ongoing, and some of them, like our caregiver trainings. That's a 6 to 8 week course. So if any organization calls us saying that they would like these programs done in their community, in their facility, we try to work to get something scheduled. This is mostly program service breakdown, in-home services. We have 3 staff available to do services in the senior center or in the community, I should say. Estimated growth. So according to the U.S. Census, and current population initially over 101,000. I am so sorry. Okay, 101,000. 60 plus has grown to over 109,000. By 2030, the census estimates it'll be almost 115,000. By 2035, they estimate it'll be about 116,000. So the difference in that population is roughly 14,181, a growth of almost 14%. Fun fact, fastest growing population. Anybody know what that is? Fastest growing age group. In that 65 and older frame, what is the fastest growing age group? Centenarians, people turning 100. Wait list at the year end of fiscal year 2025. For our My Choice Waiver Program, we didn't have any wait list. We have multiple, and this is what gets a lot of people confused. We have multiple care management programs. All of them have different requirements based on what the funder wants us to do. So the Older Americans Act Care Management Program has different requirements from the Veterans Care Management Program has different requirements from the Millage Program. So different funding sources have different requirements. So I want to make that really, really clear. So the VAAA case management, which is paid for out of Older Americans Act dollars, not senior millage. We had, at the end of our fiscal years from September to October, at the end of that, we had 153 people on that list. At October of 2025, we have 406 people on the home delivered meal list, and 148 people waiting for services in the care management millage program. Any questions?
Is this a specific area, like 148 people are waiting within all of Genesee County?
That
have
call
a-
us, that we know of.
Yes, right. Do you have a breakout for the city of Flint?
I can see if we do.
Thank you.
And are these numbers unduplicated every month?
Yes. They have to report these to me monthly. I'm going to get into updated numbers in a second.
The senior millage, in terms of wait list for senior millage?
That means that there's the need for people to get care management service. You can't get any service without having a care manager come to your house to make sure that you qualify for the service. That means that there were 148 people on the list waiting for an assessment. We only have so many care managers to go out to the home.
Senior assessment or something.
Because that's what we call the program, senior millage, because that's the funding source. Somebody asked me, what was the wait list information? Well, because I tried to make it simple so that you understood that there was a difference between the VAAA case management and the senior millage case management.
All case management.
Case management is an aspect of one of the services that are done. Case management is after your intake, the next step to receive services is to have a case manager come out and do an assessment to make sure that you are actually in need of the service. If we gave, for senior millage, if we gave everybody that was 60 years of age or older in Genesee County just homemaking, or because they wanted it, Lynn would run out of money, you all would run out of money really, really fast. So we try to make sure that the most frail population are being served. Current wait list, as of December numbers are not out yet because we're just new into January, but as of the end of November, we had 20 people on the VAAA care management program. 17 of those are caregiver. On the home delivered meals, we had 112, and on senior millage, there's 260 as of November. Those numbers could have risen or fallen. I haven't gotten the December reports yet. They're not due till January 15th.
So can you tell us why you think they're so high for this year than they were last?
Ongoing, this is the beginning of the fiscal year. Fiscal year just started in October. Ongoing, there's limited revenue and limited assets. We have, I can't remember because I have so many programs, 2 or 3 supports coordinators for millage, Lynn? 2 or 3 supports coordinators for millage. So for Genesee County senior millage. They only can schedule so much, because also what you have to remember when they're going out to do openings, they also have to go out every 6 months to do reassessments.
That's what I wondered, you don't get it one and done.
No.
Every 6 months?
Every 6 months.
Is that like best practice to do it every 6 months? Correct. Okay.
We do that across actually all of our programs. And then I do want to mention, although we serve Genesee, Lapeer, and Shiawassee County, millage numbers are strictly Genesee County. How do we verify that? We have to send Lynn a report every month of addresses so that they can verify that they are Genesee County residents, the people that we open to that program. Most requested services, information, when people are calling in. Information, the My Choice Waiver Program, care management, the VAAA care management. We have a program called Nursing Facility Transitions. That is a program, and I know a lot of people didn't realize that VAAA did so much. We have a program that actually takes people who have been in a nursing home, qualified to live back into the community. We find them housing, we get them situated and settled, and move them back into the community, and then monitor them for, I think, 3 months afterwards, just to make sure that they're okay if they don't end up being open to one of our programs. That's the Nursing Facility Transition Program. Home delivered meals is a big one. KISS, Keeping Independent Seniors Safe, that is our wellness check program. Monday through Friday, we have a team, or actually one full-time person and a part-time person, calls almost 150, 100 people every Monday through Friday to give them their morning kiss, is what we call it, just to check to make sure that they're doing okay, everything's all right. You don't need any. Most of these people live alone and they don't have close family. And I'll get into the details of those programs later. We have a program called Flint Senior Lives Matter that we get funded through the state for the water crisis, and then the senior millage. The most requested programs and services that call in through information and assistance.
Could you quickly describe the level of education, certification, degree work for the staff that do these services? Talking skilled nursing?
Yeah, I can, yes. So for every program with the exception of KISS and home delivered meals, you have to be a nurse, a social worker, a licensed nurse, a licensed social worker. For some of the programs, Waiver now allows us to have licensed PTs, OTs, and psychiatrists. They can be case managers. For our care management programs, you can be a licensed nurse, a licensed social worker, or a bachelor degree professional or associate degree professional with 3 years of case management experience. Home delivered meals, we require you can be like what's called a community health worker and do home delivered meal assessments, but you have to have X amount of years of experience in dealing with seniors. 2025 and 2026 priorities and gaps, and I'm going to get into where we get this information from. Service priorities include meals, information and assistance, support for caregivers, transportation, and those in-home services that I showed you in that pie chart. Personal care, with homemaking, respite, medication management is a LPN or RN comes out and looks at your medicines, make sure nothing is conflicting, make sure that you set them up in a pill box maybe, and make sure that you're taking them properly. Gaps in services that are identified are home repairs, mostly major, transportation, education on technology, virtual programming, and fundings for necessities that are not typically covered with grant dollars. For instance, we have a lot of seniors that are raising children. We get a lot of requests for, can you help us with school supplies? Can you help us with purchasing their uniforms? Essentials for those type of mattresses, because now their grandchildren have to stay with them and they don't have a place for them to sleep. Hearing aids, co-pays for medical visits. We had somebody who couldn't get their home delivered meals delivered because they had a nest of raccoons underneath their porch. So, we had to stop the home delivered meals because the raccoons were eating them, the senior wasn't. And so we had to pay for that animal removal so that we can get their meals started back. This happened several years ago. Fence repair, appliance replacement, those types of things are what they mean by funding for services that aren't usually covered.
Are these income associated? Any of these have to have an income requirement for these services at all?
So for the gaps in services, this just means that there's a gap. This is a need that needs to be filled. Depending on the program, so the My Choice Waiver program, for example, and I'm going to get into that later too, but that does have an income limitation and an asset limitation. The other programs for Older Americans Act and for millage do not have an income limitation, but you do have to be frail and sick.
We were hoping from your presentation to flush out some of the needs in terms of your needs assessment. If the gaps, which of those would you say is the top 3 that needs?
All of them.
All of them.
I cannot. Honestly,
Prioritize.
all of them. If I had to be forced, I would probably say, without any order, home repairs, transportation, and the funding necessities. I couldn't put those in order though.
Okay. Thank you.
You tell me what virtual programming.
Virtual programming. So exercise programs for some people don't know how to work YouTube. Some people aren't educated how to even use virtual programming. So it's education on how to use virtual programming, maybe offering some virtual programming. For instance, funeral homes now you can go online and watch the funeral. You know, maybe we can do an outreach event and make it available online, or do an educational event, not just Valley, but anybody, and make it available online, stuff like that, as well as the education on how to use the technology. Mhm. Challenges. So one of our biggest challenges is continuing resolutions, government shutdowns, and funding uncertainties. So I have been, like I said, I've been at Valley for 27 years. The past few years have been the most tumultuous. So normally what happens is we get a continuing resolution, which means, hey, they're going to kick the can down a month or two with the budget. We'll give you federal dollars only for those few months. So if they do a continuing resolution, that's fine. However, a government shutdown means everything is shut down. So for those 2 months of this fiscal year that the government was shut down, I think it was October, our fiscal year starts in October, so October and November, we had to pay out of pocket for our federal services. So that had to come out of our unrestricted fund, almost $500,000. That was the federal portion. You can't throw me a loop here. I need the technical support.
Right.
Uncertainty with the retired senior and volunteer program. A lot of people don't know that we actually have a program that is geared for seniors to do volunteerism. Well, the House totally took it out of the budget. The Senate put it back in the budget. Their fiscal year, RSVP's fiscal year, is July through June. We don't know if that program is going to get funded next year, but we are committed to keeping that program going. So if they don't fund that program under the RSVP, we're going to have to rebrand it because the RSVP piece is copywritten and all that other stuff. So we'll probably call it Valley Volunteers or something like that if they don't continue with that funding. But we need to keep approximately $250,000 back annually just to make sure that we fund that program. What does that money go towards? We have 2 full-time staff and 1 part-time staff, because KISS is underneath that program, that wellness check program. 2 full-time staff, 1 part-time staff, and in order to encourage volunteerism, especially those that are doing transportation, we reimburse them for their mileage. So a nice chunk of that is reimbursement for mileage, reimbursing the volunteers for mileage. And every year we do a appreciation luncheon for our volunteers. Another challenge is the direct care worker shortage. We oftentimes, a lot of our providers just simply do not have enough staff to meet the need to send out to the seniors' homes. Shortage in RNs and social workers. This one is huge. Where it used to take us maybe a month to replace an RN or a social worker, it's taking 3 to 6 months now, because all of us are fighting for nurses and social workers. And we don't pay what hospitals pay. We don't pay necessarily what managed care organizations pay. We've actually seen an ad where someone said VAAA experience is a plus. So they come looking for our nurses and social workers, because that means they know how to work with a specific population. And it also tends to mean they know a lot of resources that are. So that's a challenge. Increased wages, cost of living. That's a challenge. Like I said, we can't compete with what hospitals and managed care organizations pay. We can't. Increased insurance costs. Our insurance went up 24%, over 24% this year, just for insurance.
Is this the benefit package for the employees, or is this your liability insurance for the work that's done?
For the employees. And increased service demand. And here's a little bit of the trend you asked for, sir. In 2023, we spent roughly $20,000 on, $20,000 on, or excuse me, $20 million on services. 2024, we spent about 21 million on services, and that includes those special ARPA dollars. I think you've all heard of those. On 2025, we spent 20,600,000 on services. That's without the ARPA funds. And 26 we estimate about over 21 million. So the increased service, people are getting sicker. They're living longer, but they're getting sicker. And so because they're living longer, they're sicker longer. This is a lot of information, but I wanted to show you how we disseminate our older Americans Act funds. Remember, I told you we have a ton of different funding sources. Each funding source has its own guidelines. So Older Americans Act funding, how we determine the service when we go out to do focus groups and we do those surveys and we do those public hearings, we ask, what services do you think are needed in the community? If you are stuck at home, or if you're caring for somebody that's in the home, what services do you need to keep them in their home? So for the most part, the priorities are always in-home services, information assistance, caregiver assistance, transportation. I've been at Valley, I don't know how long, and those four have always been one of the priority services through the community. But sometimes services are unique based on the county. So this is just a quick glance at the services that we do in Lapeer, Genesee, and Shiawassee counties. Some services are done in one county, but they're not necessarily done in another county. We try to tailor the programs and services unique to what the needs of each county is. And then the tri-county services are services that are providers that go into all three counties or multiple counties. The way we determine, if you see it at the top after it says 60 plus population based on the 2019 census, the way we determine who gets the funding is based on the senior population. So roughly 73% of the senior population is in Genesee County, so they get 73% of the Older Americans Act funding. This is, and our board has to vote on the dissemination, and it has to be reviewed by the Michigan MDHHS. Lapeer has roughly 15% of the senior population. Shiawassee has roughly 12% of the senior population. So that's how we determine for where the Older American Act funding, how it gets disseminated.
So what percentage of this would you think would be Flint out of that?
Oh, I'd have to pull that separately. We don't separate Flint, we just do Genesee County.
I live in Flint, so I'm really excited about this.
Yeah, I'll try to get the numbers
Okay.
from Flint.
Thank you.
For the information and assistance, like Genesee County makes up 88% of that, and there's nothing in Lapeer. So what is Lapeer County doing for information and assistance?
So the unique thing about our region is that each region has a senior millage, which is actually not very common. So some regions, their millage covers the information and assistance. So we don't have to do that. So we don't necessarily cover a service, but that doesn't necessarily mean that the county is not getting it. It means we're not paying for it. A lot of times, like for instance, I can tell you Shiawassee and Lapeer have an information and assistance line. It's covered under the millage, 100% covered under the millage. This is 2025 VAAA total funding sources. Like I said, all of those are different funding sources. All of these programs have different requirements. So this is just a snapshot of 2020 year in 2025. The My Choice Waiver Program was about 16 million. Older Americans Act funding that I just spoke about was roughly 6 million. The Flint Senior Lives Matter grant was 100,000. The RSVP program, just from one, so each, this is going to be confusing. Each funding agency also has different line items of funding. So MDHHS might have a state funding line item and a federal line item, even though it's going towards the same thing. So the state gives us roughly $28,000 for the RSVP program. We have a program called Targeted Care Management. That one is roughly $65,000. The Community Transition Services, which is that nursing home transition program, we got $716,000 for that program. And let me explain why that program is so high. Like, we're literally moving people out of the nursing home. There's people, they don't have furniture, they don't have deposit, they don't have first month's rent. We are literally setting them up in a small apartment, but they have to sustain it. Veterans Administration, we $831,000 from them. Genesee County millage, for the care management portion that we do for Genesee County millage, it's $293,053. For the information and assistance portion, it's $251,460. That's also including home delivered meal assessments and reassessments. AmeriCorps, that's another line item for the Retired Senior and Volunteer Program, that they get an additional $75,000 from that. Local units of government, that's the match. We get $22,000 from all 3 counties. The KISS program is roughly $49,000. Chat is a program that we developed, especially during the pandemic, because we noticed that a lot of the KISS clients wanted to stay on the phone and talk. Well, when you got 150 plus clients to call, you can't chat. So what we did is got volunteers together in the community and developed a program called Chatting Helps Aging Adults Thrive, Chat. And then we have any senior that signs up for it, the only thing that we ask our volunteers to do is call a senior once a week and chat with them for at least 15 minutes. So that those programs get almost $50,000, and then fundraising and other programs we got about $230,000, and then the total was $24 million. Funding facts. Our average cost of all of our services per month is $1.7 million. 100% of all of our millage dollars go directly to services. None of our funding goes towards admin. It doesn't go towards my salary. It doesn't go to the CFO's salary. It doesn't even go towards the supervisor of that department's salary. It goes towards the actual service of millage. 100% of it. And that's because the need is so great in Genesee County. And we are able to, in what we call in kind. Are you familiar with that term, in kind? We in kind our admin.
Thank you. But it's covered by some other funding source.
Oh, yeah. It's just not covered under the millage.
Exactly. But, I mean, you're able to, because of the way the grants are that you get or whatever, you've got broad enough room to do that. Okay. Right. Thank you.
Our admin rate is 6.4% of all of our funding sources. 6.4% is our admin rate. 5% is covered under the grants. 1.4% of it is covered under unrestricted fund balance. 94% of all of our roughly of all of our funding goes directly towards, and I am very proud to say that. It is VAAA's goal to be able to cover 12 months of services. You never know what's going on with the economy, with the funding, with the government. We currently have approximately 7.5 months of funding. Millage clients average approximately a day a week for chore, and then that's another thing. Each program calls services different names. So we call it homemaking, millage calls it chore. They get about 2 days, 2 hours of personal care, roughly 4 hours a week on average. And then the My Choice Waiver Program serves, you have to be nursing home bound and then nursing home bound to be in this program. And this is also the program that has the income limitation. But the services cost an average of $83 a day. If they went into a nursing home, approximately the services would cost $285. So it's definitely a cost savings for people to age in the community and have their services given to them in the community.
I have a question about your fund balance. You talked about earlier that when there's government shutdown, you draw from your fund balance to cover maybe 2 months of operations, hopeful that the government will come back online. And you've talked about the fund balance. So where does your fund balance come from?
So there's 2 programs where we are allowed to generate revenue. So the millage, we have to spend all of that, 100%, and Lynn makes sure. The Older Americans Act program, we have to spend 100% of that, or we have to send it back to the state. The RSVP program, any grant program like that, we have to spend 100% of the grants. We have 2 programs where we get paid on a capitated rate. So let's just say, for the sake of argument, we get paid, and it's not just us, it's other AAAs. It's like like Blue Cross Blue Shield a little bit. They get paid $100 per day per client. If for whatever reason we can keep that cost under $100 per day, the difference we get to keep. And that's how we make a profit.
And are you on a reimbursement model? For the government funding and millage, do you have to spend the money and then get reimbursed?
Correct. For state dollars too, for all of, actually we have to upfront the cost on all of our programs.
Did you mention 100% spent for services? What were the programs?
I'm sorry, I didn't understand what you just
So
said.
you said 100% of whatever you receive is spent on, were there 3 programs?
Oh, the funding sources. Most of our grants, it's actually, to make it easier, everything except for the care transition services, nursing facility program, when they move out of the nursing home, Veterans Administration, because that's a part of the My Choice Waiver Program and the My Choice Waiver Program. Those are the only 3 programs where we are allowed to be able to put money in our unrestricted fund balance. All of the other funding sources that you saw have to be 100% spent, or we have to give them back, or we just can't draw them down.
Is it with the programs where you're allowed to maintain, keep some dollars back because you provided the service at less than what it, at a greater cost savings? Is there a reason you need to keep those dollars back and hold?
Yes, that's a very good question. For those very reasons why I said, when I became CEO, I told the board I wanted to have at least 12 months of money in our unrestricted fund balance. You should never put I was taught very well, you should never put all your eggs in one basket. You don't know at any given time when a funding source is going to stop. And then we have to pay for that. If we're going to keep that program going, if it's a priority or if the community needs it, we have to pay for that out of our unrestricted fund balance. And then sometimes the state has programs that they're going to mandate in the future. So for instance, there is a program that the state is going to take statewide in 2027. We got to hire up front for that program. So we need money in our unrestricted fund balance for that. Last year, now we never get our budget at the beginning of our fiscal year. Never. So we have to guess what our budget is going to be from the state, from state and federal. Every year, they tell us to go by your previous year's budget. Last year, remember I said our fiscal year starts in October. It ends in September. Do you know we did not get a full year's budget until June? June, July, August, 3 months. 3 months until the end of our fiscal year. And we're supposed to, so we do contracts, and I'm going to get into that in a second, but now we get cut. We don't know if we're going to get we don't know what we're going to get until we get it. So then if we get cuts, we have to sometimes pass those cuts along to the providers. And then they're like, oh my God, how are we going to cut? Nutrition got cut too. Nutrition, when I say nutrition, is congregate and home delivery. Last year, nutrition got cut from the state and federal budget by almost $260,000. We were able to cover some of that cost. And I think some of the reason why we had some overages too was we used to have what was called carry-out meals. During the pandemic, the seniors, then you can't congregate and have a congregate meal. And so we were letting them carry their meals home. Well, in May of 2024, the state told us, hey, look, we're stopping the carry-out program. We want you to encourage people to come back out and congregate. So we made the decision we're not doing, and then the biggest piece is carry-out meals have to be paid for under the home delivery meal program starting in September 2024.
Excuse me, just real quick, Mr. Chair. I know we had a question over here, and I
I'm
also,
sorry.
Kathy had one. And then also just keep in mind time, we're at about 3:30. We got about another half an hour. So I just wanted to let you know.
Question as it relates to the My Choice program. Now, that's the program where you're able to provide nursing home-like care, but in the home and not in the nursing home. So some of these, you said you had 3 programs that you're able to
Correct.
keep some money back for.
Correct.
For that My Choice waiver program, do you have clients in there that are very expensive? Because in nursing homes, these
yes.
people. So can you turn people away
No,
from the My
we
Choice
cannot.
program
So
because
for-
they're costly?
So the My Choice Waiver Program is a Medicaid-funded program. You cannot turn people away for that program. The reason why it's called the My Choice Waiver Program is because it waives the dollar amount that an average person off the street can make and still qualify for the program. This year, it's almost $3,000 that a senior can make in income, have one house, one car, and up to $10,000 in monetary assets and qualify for that program. We cannot, if they qualify for that program, we cannot turn them away. And yeah, we had a client who, her aide had to be a nurse. It had to be a nurse. She did not want to stay in a nursing home. We transitioned her out. She had to have a morning nurse, an afternoon nurse, and a night nurse. If her nurse didn't show up, she had to actually sign a waiver. She had a trach, couldn't talk, 100% bedbound. If for some reason her nurse didn't show up, they had to call 911 and take her to the hospital because she wouldn't. So that was a very expensive client. So yes, we do have high cost clients in that My Choice waiver, and we cannot turn them away. And you said some gentleman over there had somebody. Oh, it's just Kathy. Okay. Okay, I'll try to rush through. We have what's called service provision. So VAAA does. We have 2 ways that we spend money in the community. We do what's called a request for proposals, where we put the dollar amount out, the service out, and then organizations do a RFP, like applying for a grant. It's every 3 years. And then we monitor them for if whoever receives it, we monitor them for program sustainability and fiscal sustainability. Our current subcontractors are right there. I'm not going to go over this in your packet because I know we're sensitive for time. Now, these are subcontractors. That means they get the money, they manage the money, and then we just oversee them to make sure that they're spending the dollars right and that they're running the program correctly. They get, and they draw, what happens is they draw down on the money, usually about 1/12 per month. We also do what's called direct services. That means VAAA staff actually directly provides the service. Subcontractors are other organizations. VAAA directly provides services too. And these are the services that VAAA directly does. Let me see. VAAA, all of our programs have an opening assessment and a reassessment, usually every 6 months. Some of them are every 3 months. VAAA supports coordinators work with the participant and the family if the participant feels comfortable to develop a care plan. We then order the service using we have 82 service providers to choose from for our direct purchase of service. Unless it is millage, because for millage, we have to use millage providers. But for our other programs, we have different programs providers to choose from and see if they can fill the care plan. We audit at least 25% of our DPOS providers annually. That's a mandate now. It used to be 10%. It went up to 25%. We get 2 audits, 1 fiscal, 1 programmatic, and we also audit any provider that has multiple complaints from our supports coordinators or from participants. And then these are some of the criteria that qualify for all of the different programs that I spoke of. The My Choice Waiver, our Older Americans Act Care Management Program, these are some of the criteria that they have to have in order to get on those programs. Millage, this is the criteria to be able to receive some millage, these particular millage care management services. This is what's for the community transition or / nursing home transition program. Home delivered meals, this is the criteria for that program. Here's KISS, is what we talked about for the wellness check. CHAT, RSVP, the Retired Senior Volunteer Program. And if anybody is interested, there's a number on there that you can call if you're interested in volunteering. We're always looking for volunteers. And these are our wellness programs, Ms. Taylor. This is what you were asking about, programs in the community. These are the programs that we do actually in the community at different organizations. And these are education. If you look in your packet, that's all the stuff that we provide in the community.
Question. I noticed that you don't, under your Older Americans Act, fund senior centers.
Right.
So maybe that's where you and Lynn have an agreement that you don't duplicate your dollars.
Yeah, the duplication comes in priority needs services with high wait list.
So my question is since you don't fund senior centers, how do you, since you represent all of Genesee County, how do you support senior centers with your dollars?
So all of the programs that we have staff that go into senior centers. Well, number one, Valley is the one that pays for congregate meals. So senior centers, the bulk of the organizations that get the congregate meals, that are congregate meal sites, are senior centers. Those fundings come from VAAA. I'm thankful for the commissioners and for Lynn because they did cover our overage last year while we were transitioning for the carry-out meals to back to congregate. Because of some complications that was going on with the senior centers. And just getting seniors used to getting back in the swing of congregating together again. But we literally have staff that we pay for either with other funding sources, not millage, that cover these programs in the community. Did I answer your question? I'm sorry.
So I guess, you had wellness programs in that. I saw that you fund. Are those programs offered through the senior centers?
Yes. So it's a win-win for the senior centers and for Valley. We get to meet a number of clients being served. Senior centers get to, and churches and whomever else, get to have free programming in their centers. They don't have to pay for the programs.
That's under the wellness programs and the educational programs?
Correct.
But they're able to count it for the numbers for their receiving funding through the senior millage.
I believe so. I think on the little machine thing, I think that it asks.
So that's part of how they get their numbers to qualify to get the funding from the senior millage.
I believe so, yes.
They have to meet.
And I think there's different tiers. I don't want to speak out of turn. Okay.
They have to meet certain criteria in terms of educational programming, and these programmings that VAAA offer are counted towards that.
No, they don't. There's not certain. The wellness programs, education programs, the criteria is you just need to be able to come to the program.
Right. But I mean, the senior center is allowed to count those attendees for that.
Oh, yes, absolutely.
And I know in my own senior center, the diabetes, the nutrition, the healthy eating, those are programs that we've had at my own. Continue.
Yep, and I want to say that we always did the healthy eating, but Michigan, we used to partner with the MSU extension, that program got cut. So that's a program we picked up. Caregiver, we did caregiver programs. These are just some community things that we. This is how you refer a client. You can have a paper form. You can go online. You can call us, you can go on our website, or you can do referrals through one of our online referral outlets.
Do you have a staffed call center for if someone calls? Do you have
That's
like
our
a
information.
staffed call center?
Remember when I talked about the information assistance department? That's them.
Okay. So, well, if someone leaves a message, or even if someone calls and they have a question and they can't answer it, do you have a standard of service to get back with them?
We have to. We used to be within 24 hours. Now it's within, because we have so many phone calls. It's within 2 days. Most of the time, two business days. So you got to understand, and this is what a lot of people don't get. Intake can, while they're on the phone doing an intake to see what program the person qualifies for, that could, depending on the client, that could take anywhere from 30 minutes to an hour to do an intake. So when the phones ring, they're gonna go to voicemail. So they do have to call back within 2 days. And we do say that on our voicemail. Someone will call you back within 2 business days. And questions?
Good presentation. Thank you.
Thank you. When I said we had surveys too that we give to homebound people, I do have a copy of those surveys if anybody is interested. Thank you.
Moving on with our new business, the next item on our agenda is upcoming meeting details. The February 5th agenda, we need to talk about other community agencies that we're asking to do any type of presentations, and what other items of agenda for that meeting.
Mr. Chair, Gwen will kind of roll through kind of some of the stuff we talked about for the next meeting and who we have confirmed today and who we still have waiting for confirmation for our next meeting.
In the previous meetings, we discussed having a representative from U of M Flint come. We also discussed having somebody from the state of Michigan come, and also Greater Flint Health Coalition. Currently, we have Greater Flint Health Coalition confirmed to do a 10 to 15 minute presentation on needs and gaps and trends. Still working on U of M and the state of Michigan, but who else do you want to see at the February 5th meeting? That was U of M, yep. They have a research cluster that focuses on seniors, so I've reached out to them.
So Michigan State, I'm sorry.
It's the U of M Ann Arbor campus, I believe, isn't it?
I believe it's Flint campus.
Is it?
Yep,
Okay.
yep.
So Michigan State doing the same thing, or we don't know?
Would you like me to reach out to Michigan State? I can absolutely do that.
Thanks.
Our next item is we need to move the March 5th meeting to March 12th. We've had a request from the vice chair. She has a conflict. She can't move around it. I would like to move it to March 12th solely because I'm dancing around some personal health problems. And if I'm not available and she's not available, we won't have anybody to run the meeting. So we're hoping that with enough notice, there's no issue with moving the March meeting to March 12th.
And that would be the same time,
Correct.
and we'll confirm on the meeting location, but be playing the same time, same location.
Same time, same day of the week, but just a week later.
Yep. And then we'll we can update the website and make sure all the notification stuff is correct.
And the final item on our agenda is that we've gone through 2 sessions now in which we've had presentations. There has not been much time in terms of the task force members' comments, so we would like to open it up to comment.
Mr. Chair, just real quick before we start comments. At the end of the last meeting, there was a list of questions that task force members had from the presentation. You'll see another packet. We went through and captured all the questions that were asked, and there was quite a number of them. And so you'll see in your packet answers to the questions that were asked at the last meeting. Those were all the questions and answers to the questions. So as staff, even in like today's meeting, we'll go through and see what questions people asked, make sure we get answers to those, so you'll have those as well. So that's not something we weren't doing a presentation on, but those were additional questions that people had as we went through the presentation. You're welcome.
Yeah, I appreciate that. And we'll look forward looking through all of that information. One thing that, as we've been meeting and talking about all of this, that I've wondered about, and I guess I'm going to use the comment time to share this thought with all of you, this wondering. And it might be something that we could have the county staff address, is the frequency with which this information or this department is actually making presentations to the county commissioners as a whole about any of it. The services, the gaps that they're seeing, and their RFP process, and all of those things that they do that are critical to being able to provide these services. Because I'm not sure how much information that we're seeing actually goes to them. But in addition, systemically within the county governmental system, I don't quite understand how it is that the commissioners are able to make their decisions if they're not getting this information. So this is helpful, but that may be one thing in a couple of months when we're meeting, we might want to ask to have more guidance on from the staff. And
When you say guidance, are you looking for the county staff to provide specifically what? I missed.
so for me, it's the systemic process by which the commissioners who make the decisions are actually getting the information, the frequency with which they're getting it. What does it look like when they get it? Do they see what we've been seeing, like every 3 years, every 5 years? They'll get the annual amount from the millage that's available to be divvied up, but do they make those decisions based on facts that they've seen that are current? I don't know. And so I'm wondering about that, because while I think this is important for us to be able to do what we need to do, the other side of this is we could make recommendations, but if systemically the system isn't set up to receive these recommendations, we may be expecting things are going to happen and there's no framework for which it will occur. So that's my wondering. And part of it is based on, not really knowing how these things happen, how any of the departments report to the county commissioners. They're the only report when there's a problem. Don't know.
Well, they did compliment Brad and Lynn at the last not the last meeting, but the meeting before, for where we are. So they know we're here. It was something they asked for. But I think this is a lot of information. I just want to know, can we lobby them to get more?
Let me just jump in and I think, and what I'm hearing is this is a lot of work to go through this. So how do we set this up for success going forward, right? Like, what are the steps And that probably makes sense coming from this group to say, whatever, having gone through this, as we get into the implementation recommendations, these are the recommendations that this group thinks make sense for this program. We can definitely go through and give information as what the current state is, right? And then this group can take a look at that and say, we think it makes sense that A, B, or C happen on a 3-year basis, whatever, so that there is a better, more robust process of improvement.
Something that's built in, because this only happened because pressure was applied to the county commissioners about funding for the senior centers. And so they responded to that. And then the task force was created to hopefully prevent from some of that happening in the future. So we can look at this and say, we think these are the priorities for now, but 4 years from now, things could change, as we've seen already, how much the senior population is going to grow, and that demographic within that senior population is not at the 60 age, it's at the older age. So I just want to make sure that to the best of our ability, we're trying to build in something that's going to provide a mechanism for both the staff and the commissioners to get information to make good decisions going forward that are more proactive than reactive, because that's what I feel has been happening in the past.
Also,
Thinking about, go ahead.
oh, I'm sorry. Also, I think I mentioned, or maybe I didn't. There are other communities that have senior millages. Grand Rapids side of the state has senior millage. The area agency does it over there. Toledo area, just outside of Ann Arbor, has a senior, they call it levy. Is it, you can go online and see what they fund, but it would be nice to know at what levels they fund their different programs. I mean, just for some comparison's sake, how much money do they put, if they are funding senior centers, what are they putting in their senior center budgets? If they are funding in-home services, what kinds of, to what extent? It'd be not that, it wouldn't necessarily mean that we base our decisions on that, but it would help us with some, here's what they're thinking and here's how they did that. Just for reference information, just for information purposes.
One of the things I would like to comment on is maybe part of our recommendation is that we recommend that there be future task force, and that we also set up a blueprint of what we did here, so that if there is a future task force, they have something to begin with. Because one of the things I feel that if it wasn't for the Planning Commission, we would have really been struggling, and we're still struggling, I think, to some extent, of what to review. And I think, a blueprint of that review type process needs to be established, and a recommendation that there be future task force services or committees.
I'm also, the amount of work that we have to do, and I'm looking at way things existed in Genesee County way back before 1965, when this this AA Act, Older Americans Act, was put into place. And so I think we need to set up opportunities for people that are interested to work continuously, not every day, but set up a subcommittee maybe or something like that of people that want to take and plan longer term. Because just there's too much for me to and there's too many options and possibilities that we could do things differently, systematically, you were mentioning, to bring about in 2 or 3 months. And so there's a whole communication area between seniors and the community and all aspects of our community. I'm thinking about our young people. I'm thinking about what their needs are. My grandchildren, and there's so many changes going on now that I think that as Genesee County, we need to start looking at pulling ourselves together because things coming down from Washington and Michigan, from the state, affect us. And we need to find a systematic way that works for us so we can move forward regardless of what the administration is doing in Lansing or Washington. And so I'd like to propose we set up some kind of ongoing committee to
I think we
not
can make
just
that-
not just us, but involving a lot of different areas to start looking at the overall picture, how one thing interacts with the other. And we can make, as seniors, those of us that are healthy can make a major impact on our children. I'm thinking of the family unit that used to exist that did all of the things that we're trying to do here. There was no ballot agency on aging. There was no senior millage. And yet we took care of things within the family and the extended family and the neighborhood and so forth. I think there's opportunities to try and if people are educated young and they know what they're going to be responsible for, that they aren't going to put off until their later ages, starting to ask themselves, "Oh, I better take care of myself." Those attitudes come in the first few years.
Well, Russ,
I'm finding out
we might be
things.
able to make a recommendation for the commissioners to consider. There's a survey that I got just recently about the county plan. Isn't that something that's out there? So there's opportunity right now for the public to make comments on the county plan, but the kinds of things that you're talking about are much larger in terms of the scope of all of how we relate to each other and how families are defined. And gosh, it would be great if we could, say, here we go and have the world be changed, but that highly unlikely, but I think we could take that as a recommendation. I know, Lisa, you wanted to say something.
I was just going to say that I agree with you and Richard that I hope this isn't a one and done. I hope that they don't take what we give them now and whether they accept it or don't accept it. Just taking our knowledge of what we've looked at to come to the decisions that we give them. And like you said, review it in 2 years, because this is a 10-year millage. Look, review it in 2 years or 3 years or 5 years. And does the information that we based our decisions off of and our recommendations, do those still apply in the 2-year, 3-year, 5-year world? So like I said, I hope this, like you said, it was reactive, and I understand that. I just hope it's not a one and done to that reaction. So I hope
that, and
that's part of our plan.
I like that, and I like the perspective that, wherever they move forward, they have to look at that time and place because things are constantly evolving.
Right. I mean, because we can see in the population changes. So, we're going to make our decisions now based off what the populations are today and our experiences today. But very well in 2 years, that could change. I guarantee it's going to change in 5 years. Yes. So, that I'm hoping that that's one of our recommendations is that 2, 3, 5 years that this is reviewed and, they get an apples to apples approach as to what we saw to make our decisions and our recommendations.
With that being said, we're at the end of our time limit. It's 4:01. Unless there's any burning issues, I'd like to call the meeting to an end.
I hate to wait another month. Can I make a motion that we set up a committee to work of people that are interested in looking at possibilities for long term?
I would rate, not saying that's a bad idea, Russ, but what I'd like to ask is if you would be willing
Yes.
to wait till after the February meeting, because March's meeting was supposed to be this prioritization, and we may decide that at that time we're not ready to prioritize, but might then reconsider your idea about what our next steps would be. So can you kind of put a pin in that for after the February meeting?
Yeah, there's nothing. If I don't have support,
No, I
if
appreciate.
there's nobody else interested.
No, I appreciate
what
it.
you're
Yeah.
saying and your urgency, Russ. And I think that you keep pushing us in that area. And I don't know if you know that the county has a planning department that maybe we could have information presented so you could get how the commissioners get other information, not just from us. And the survey, did you receive the survey?
If I understand correctly, yeah, I'd be willing to work with any other planning department. Yeah.
Make a motion that we adjourn.
All in favor?
Aye.
Aye.
Nays? Abstentions? The motion carries forward. Thank you.